And without further ado, patient-centered care, bereavement care in oncology. And we're here with Reverend Bailey Brislin, MDiv. Very nice to meet you.
Yeah, nice to meet you as well.
Thank you so much for being here.
Thanks for having me.
Well, let's find out a little bit about you. We've got your bio there, and then we've got some highlights. So 2022 and 2023, you were the recipient of the UNC School of Medicine Gary Winzelberg Excellence in Hospice and Palliative Medicine Teaching Award. So congratulations on that.
Thank you.
And we are huge fans of Dr. Winzelberg, who has
yes.
done previous presentations on this series.
Yes.
You're a board certified chaplain through the Association of Professional Chaplains and completed your training for clinical chaplaincy at UNC as a pediatric chaplain resident and loves working as part of an interdisciplinary team and loves providing education and support to promote healthcare worker sustainability and wellness.
Yeah, that's right.
So what else should we know about you outside of the professional realm?
Yeah, well, outside of the professional realm and outside of work, I have a 7-year-old rescue pit bull. Her name's Olive, and she is a great accountability partner in my self-care practice, making sure that we spend time outside every day.
That is great. That is great. So, and I've had privy to see pictures, so she is a sweetie.
I'm
can
biased,
testify.
but she's cute.
Yeah, absolutely. And I understand that today is actually your last day with UNC.
That's right.
You were going to be missed. Tell us a little bit about what you'll be doing next.
Yeah, thank you. It's a very bittersweet day to be stepping away from a beloved role here at UNC, but I'll be transitioning a few miles down the road to work with Duke as a home hospice chaplain there.
Great. Well, congratulations, and we wish you the very best with that.
Thank you.
Well, let's go ahead. I mentioned Poll Everywhere. We'll be using that. So I'll flash up our various disclosures, and we don't have to read those. And then our first Poll Everywhere question, we try to make this kind of a softball before we get into the presentation. The anguish experienced after a significant loss, including the death of a beloved person, can be described as grief. And that's a true or false. So if we can ask our audience to go ahead and just select true or false, we'll wait a few seconds to give everyone time to do that. And Reverend Brislin, what's the answer you're looking for here?
We're looking for the answer true here. Oftentimes anguish is an emotion that we highly associate with grief, especially after the loss of a beloved person in our lives.
All right. Well, thank you for that. And bereavement care and oncology, I'll go ahead and turn the controls over to you.
Great. Yeah. Well, as we've mentioned, we're going to be talking today about bereavement care in oncology. And so we're just going to start by kind of thinking about an outline of our conversation today. So we'll begin by getting into the basics of grief and bereavement so that for our conversation we have kind of a shared understanding and definition about what is grief, how do we experience that, maybe both personally and professionally, and what is bereavement and bereavement care. We'll talk about different models of grief theory and how we can apply grief theory to offer grief and bereavement support in a practical way for oncology clinicians. And we can think about that as clinicians of various disciplines that may encounter bereavement and grief in your work. So I think, first off, why is bereavement care important to talk about in the field of oncology? And you'll see before you this graph here that talks about sort of the leading causes of death in the U.S. And the statistic is maybe unsurprising, but cancer continues to be a leading cause of death in the U.S., which means that unfortunately death and dying and bereavement continue to be a reality for our work caring for patients and their care partners in the field of oncology. So I think part of it is just the prevalence of how often we encounter death and dying in our work in oncology. I think the second thing that's important to think about when providing bereavement care is that there are layers of grief and losses that we encounter with our patients and their care partners, with colleagues personally. And so thinking through kind of what are the layers of loss, even beyond thinking only about death and dying. And then I think another important reason to think about and have proactive conversations about bereavement care is that it can help promote resilience and sustainability in this work.
All right, and here's that next poll everywhere question. Grief can broadly be characterized by 5 stages, including denial, anger, bargaining, depression, and acceptance. And so again, this is a true or false question. If you'll go ahead and indicate which one you think is correct, and we'll give our audience a little bit of time to do that.
Yeah.
All right, Reverend Brislin, which answer are you looking for here?
We're looking for the answer false here. These 5 stages may sound really familiar to you because often in pop culture, you may hear a lot of references to the 5 stages of grief. And if you look at this list before you on the poll everywhere question, those are all emotions that people may experience as part of their grief. But as we'll talk about today, grief is actually maybe a little more complex and nuanced than these 5 stages would indicate. So we'll talk more about that as we go on. But I think a definition that I really appreciate when we think about just in its most broad form, what is grief? This comes from social workers Eleanor Haley and Lista Williams. They started a project actually that is called What's Your Grief? And they offer this definition, that grief is a constellation of thoughts, feelings, and experiences that impact the emotional, cognitive, behavioral, spiritual, physical, and existential domains of life. And I know that definition is a bit of a mouthful, but I think what it encapsulates well is that grief is a whole person experience. It's something that impacts our physical self, our emotional and spiritual selves. Every part of our being is impacted by grief. Think also this imagery, if you think about the imagery of a constellation and the kind of webbing in a constellation that kind of exists above us at all times, I think that's a poignant image to think about with grief to keep in our mind. And just having this image that grief is truly impacting all of these pieces. I think you'll see as we continue conversation today that each of these elements, behavioral, cognitive, emotional, physical, these are all going to come up again as we think about grief being not a process with a beginning and an end, but a more complex state of being, something that happens in our lives. I think another thing that's important to keep in mind is that every grief is different. Each individual person has a unique experience of grief, and each loss we experience in our lives is unique. So I may experience, many losses in my life, and my grief and reaction to each of those losses is not necessarily going to look the same. Just like me and someone else in my life, we could experience a similar loss and have a different reaction and response. That unique piece is important. I think, as we'll talk about more today as well, grief is not only about death and loss of life. We can grieve anything, any kind of change or transition in our lives. I think oftentimes what I'll say to people that I'm working with who are grieving too is that grief calls out to grief. And so when we've experienced one grief, that continues to live with us in a way, and it may return to us when we experience other losses and transitions in our life in the future. So while grief is kind of this big, I like to think of it as kind of like a big bucket term, there's some more specific forms and types of grief that we can talk about, right? If we think of grief as our natural response to loss, there's all of these ways we can sort of capture how grief may present for us. And I think having specific terms and labels is valuable because in some ways what this does is it normalizes and validates a particular experience. And so if there is a specific term to describe something that you are experiencing and struggling with in your daily life, and there's research surrounding this term, that is a way to honor and validate your lived experience. So I think these terms can be valuable to hold in our awareness when we're thinking about grief. So I'll sort of run through each of the ones you're seeing before you right now. The first one is anticipatory grief. Whether you've heard this term and this feels familiar to you or not, I imagine that you have encountered this in your work. Anticipatory grief is the type of grief that begins the moment we know a loss is inevitable. I often experience in my work as a clinical chaplain in the hospital that often when anyone is dealing with a serious illness, the moment that they are beginning to process their mortality or the mortality of their loved ones, that is an expression and experience of grief. The grief doesn't just begin after the loss. That's anticipatory grief. Preparatory grief is in tandem to anticipatory grief. That's when we think about the experience of a person themselves who is dying and that internal preparation work that happens when you are anticipating your own death. So this would encompass all of the physical and emotional changes that are a part of the dying process. Cumulative grief is the kind of grief that happens when we experience loss upon loss. I talk about this a lot with healthcare providers and my colleagues when we think about the number of losses that you may experience professionally when caring for very sick patients. Similarly, if you experience a succession of losses in your personal life, that may start to weigh on you in a different way. That's cumulative grief. Collective grief is a term to describe the type of grief that happens when an entire community is affected by the same loss. And when I say community, I mean this could be a certain geographical region, like a city that is impacted by a certain loss, a state or a nation. It could also be a religious group, an entire ethnic or racial group that experiences a similar loss. When I think of collective grief, I think COVID-19 is a kind of collective grief where we simultaneously, as a collective, human experience of so much loss at one time. That's just one example of collective grief. Then disenfranchised grief. If we're talking about the value of having a term to validate an experience, this is the type of grief where this can be so valuable and important. This is when the grief is maybe not culturally recognized, or people feel like they may need permission to grieve, that it's maybe not as talked about or as open for them. So things that may be disenfranchised grief, pet loss can be an example of this. It may be hard to think about why the loss of a pet would be something as significant as the loss of a human life. Another form of disenfranchised grief is loss, death by suicide. In many cultures and families can be a form of disenfranchised grief where people may not have the language or knowledge to know how to talk about that with their families. It's a sensitive type of loss. That's disenfranchised grief. Then complicated grief. This is when the type of an experience of grief goes beyond maybe what is expected for the type of loss that you're experiencing. And we'll talk more about complicated grief a little bit because complicated grief has taken on many different names in its time. And just as an acknowledgement, there is a DSM diagnosis relating to the experience of prolonged or complicated grief. And while we're not going to talk today in this presentation about the medical model of responding to grief in that way, I just want to acknowledge that if you wanted more information about complicated grief, there is a body of research about that. So what are some of the things that impact somebody who's grieving, their experience of the grief process and bereavement? We've got a list of things here for you. This, I wouldn't say, is an exhaustive list, but I think these are some of the important things to think about. How is somebody's bereavement and grief going to present for them? I think a big one here is culture and religion, right? How is death and dying and loss being talked about in this person's culture and family? What traditions and rituals exist for them around death and dying? How are they seeing models of expressing grief? Maybe that's in their family of origin or in the places and spaces that they spend most of their time. Another one is identity and social location. So there's a lot of research that talks about how level of education may impact somebody's ability to adjust with grief. There's a lot of factors that can impact somebody's experience and ability to, for example, take time off from work. We see often that in poor communities, there is less space for people to act upon and have space to process their grief, and that can impact their experience in grieving. Another one is coping skills. When we think about somebody's inherent coping skills, in a time of crisis or increased distress, like a time when you're experiencing loss and bereavement, are you able to access those coping skills, right? You may have them, but are they seeming useful for you? That is a factor that can impact somebody's experience of grief. A huge one when we're thinking about grief in relation to death and dying. What was the relationship with the person who died? Is this the person you spent most of your days with? Were you their caregiver, right? How were you connected to and related to the person who died? Another thing that can impact your grief experience is thinking about what was the experience of the person who died, especially when we're thinking about in oncology care and in healthcare. When you're thinking about somebody who was sick at the end of their life, was that a traumatic experience? And if so, how? Was this a sudden or shocking death? All of those things, the circumstances of a loss, will impact the family and care partner's experience of loss and bereavement in the future. And then maybe, not most importantly, but I think a huge factor in how people experience grief and bereavement is their embedded social support. So who are they turning to for care and support through the experience of grieving and this kind of interruption in their life after the loss of a loved one? So that's kind of a zooming out, large scale, what is grief? Okay, and I think it's helpful to think too about, as we have this conversation today, about how do we support people in bereavement and provide care to them, to know, how are we thinking about and theorizing around grief and how it presents for individuals and communities. So up here I have this kind of timeline and history of grief theory and how we've been talking about this over time. You'll see that we start kind of with this model in the 1920s with Freud, who was talking about grief as something simply to be healed from, that we can get over, that there would be a way to sort of leave grief in the past, and that healing from grief, which would have been the goal, requires detaching emotionally. And then as we move through the 1900s, we have different theories that we describe as stage theories or grief work theories. You have Lindemann's grief work theory in the 1940s, which talks about how to, again, kind of release the connection to the deceased and then readjust and move on. As we started with a poll everywhere question about this, in the 1960s, Elizabeth Kubler-Ross's 5-stage model of grief enters the picture. And there's a lot of discourse around her theory of 5 stages of grief. And I think it's an important one for us to think about because when it was presented, I think the commentary we have from Elizabeth Kubler-Ross even today is that she never intended for it maybe to catch on in the way that it has and be applied in such a broad range of settings. And so what I'll say as we talk about each of these theories here is that I don't think that any of them on their own need to be completely set aside, but I want us to see that there's so many different things happening with grief theory here. As you look at each of these boxes, that maybe no one of these theories that we're looking at fully encapsulates this diverse, unique experience of grieving. But of course, the progression for Elizabeth Kubler-Ross here in these stages that, as I mentioned before, these are emotions that people may experience in their grieving process. But what can happen in a theory, the stage theory and how it's been applied, is that it almost becomes prescriptive. And so when people are not experiencing maybe one of these emotions or not in the order that they're proposed, that is something that can cause harm to the person who is grieving. Then we move on and we have a couple of other stage theories here that talk about Bowlby's 4 stages here, working through the shock and numbness, yearning and searching, despair and disorganization, and reorganization. You'll see that all of these sort of have a trajectory where grief may have kind of this pathway that you're following. The tasks of mourning are things that people can do as part of their adjusting to the grief process. So all of those there have a similar model in that they're stepwise stage theories. But in the 1990s, there is a new theory that comes about. It's called dual process model of grief and oscillation theory. That's where we're going to spend more of our time today talking about what is this new theory that comes on the scene that is not a stage theory, and what can it offer to us when we're thinking about supporting people in the midst of their grief. And so the other theory that goes right alongside dual process model is this idea of continuing bonds, which says that grief is not about letting go or moving on, but instead about how the relationship with the person who's died continues in a new way. We remain connected. And that is a counter to some of these earlier understandings or theories around grief that adaptive coping means completely leaving something in the past. So we've talked about this a little bit, but I think it's worthwhile just because we're going to hear about stage theory. I learned about stage theories of grief in basic courses, growing up. I've heard so much about it, and there's movie references to it. I think we're going to keep encountering it. And so I just want to talk through a little bit of why maybe we want to think about some alternative ways to describe and think about grief and bereavement. So one of them is just that there is actually a lack of theoretical depth and explanation. And this assessment that we're looking at comes from Strobe and Shute, who are the theorists who propose dual process model that we'll be talking about next. But they're saying that these stage theories have a lack of theoretical depth and explanation, that there's maybe some conceptual confusion and misrepresentation of grief and grieving. There's a lack of empirical evidence to support the models that are proposed and how it's been seen played out for people. I think at this point, too, there is availability of alternative models, and so relying only on stage theory maybe doesn't offer us as zoomed out and broad of a perspective. And then I think maybe for our purposes today, the most important is to think about what are the consequences if the only way that we're framing and thinking about grief is using stage theory. This quote here again comes from this research from Strobe and Shute. And they say that the stage model can have devastating consequences. Not only can it lead bereaved persons to feel they are not coping appropriately, but it can also result in ineffective support provision by members of their social network, as well as unhelpful and potentially harmful responses by healthcare professionals. So I think that this is where our work comes in, right? If we have other models to turn to and ways to think about grief and grieving that may prevent this kind of harm and consequence to people who are hurting, it's worthwhile to explore those things together. And what I'll say is that when we think about conceptualizing grief and grieving, I think it's helpful to note that this is a hard and complex thing to talk about, right? We have a hard time, I think, finding ways and spaces to talk about grief very openly, and it can even be hard to bring to language or to imagery our own experience around grief. And people have been trying this for a long time. So these next few slides are just a couple of images that I think show the variety of ways that people conceptualize and have tried to bring language and imagery to grief. I love this picture here that shows kind of on the left this clear-cut stage process in grief where it goes from loss and hurt through all of this big dip and then lands with adjustment back on the same plane where you were before the loss ever happened. And then I think on the other side, maybe this resonates with you and experiences you've had in your own life, but maybe grief is a lot messier than stage theories allow for. Maybe we do touch on all these emotions that are part of this dip, but maybe not in a clear-cut pattern, and maybe some of them we never connect with ourselves. I think this image is beautiful in describing, this offering that maybe people tend to think that our grief shrieks over time, but what really happens is that we grow around our grief. Here's another one from an artist that talks about this idea that maybe over time we learn to carry the grief differently. Maybe initially it feels like this big sack that's unwieldy and hard to carry around and impacts our ability to move about our daily lives. But over time, it's not that the grief is no longer with us, but we're holding it and carrying it on our person in a different way. And I think that kind of imagery that we're talking about there is what Strobe and Shute were trying to do in thinking about dual process model of grief. And so this imagery right here, which we're going to come back to when we talk a little bit more about it, this is the image that they're using to describe the process of oscillation theory and offer a way to describe the experience of grief and grieving. So what is dual process model? It's actually a model of coping. So when we're talking about this theory of grief, it's not just a description of what grief looks like, right? It is describing the experience of grief, but it's also showing how people cope with their experiences of grief. So they're basing this on saying that there's two types of stressors. There's loss-oriented stressors and restoration-oriented stressors. And that grief involves oscillating between loss-oriented and restoration-oriented coping, as well as taking breaks from those types of stressors entirely. So let's talk a little bit about what is a loss-oriented stressor and what's a restoration-oriented stressor. So loss-oriented stressors are the activities and things that are directly related to the death or loss. This would be thinking or ruminating about the loss. Those things you think of as more emotive that kind of stop you in your tracks, like crying, looking at old photographs, reminiscing, telling stories about the loved one. Maybe you're experiencing something and find yourself wondering and imagining what your loved one would say to you in that moment. Those are things that we would describe as loss-oriented stressors. Restoration-oriented stressors are the activities or stressors that are associated with the secondary losses regarding lifestyle, routine, and relationships. So this is including learning new skills, forming new relationships, maybe taking on roles previously done by a loved one. This could include sort of daily things like cooking or finances, going to different appointments. I often talk to people if they've lost a partner or a spouse, where I may be meeting them, right as their loved one has died, and all of a sudden they're wondering about, how am I going to pay the bills that are due next week? I've never done that before. That's a stressor. A changing identity as well. If you think about, there are some relationships that come with labels and terms. If you are a spouse, if you think of yourself as a wife and you lose your spouse, you are now a widow. When I worked in the children's hospital, I often talked with parents who wrestled with the identity after losing a child, thinking about, what is my identity as a parent right now? There's no new term after you lose a child that describes that you are a bereaved parent. Right, but our identity can shift and change in the wake of loss. So when we look at these two lists right here, and again, these are just a couple of ideas of things that would go under each of these categories. The list is probably somewhat endless when you think about the various experiences that people will have. But I think it's important to note that the loss side and the restoration side are thought of as stressors, right? It is both a stressor to be in a place where you are emotionally changed and moved by the experience of losing somebody and brought to this place of rumination or remembrance. And in the wake of that loss, these restoration things are also sources of stress often, right? To process your changing identity, to take on new roles in your day-to-day life that maybe once were occupied with somebody else. We speak to a lot of people who are caregivers who they're not only grieving the loss of their loved one, but this identity, I was a full-time caregiver. What now? What is my day-to-day life going to look like? And so we want to think about both sides of these as stressors that a person is experiencing, right? But what dual process model says is that being able to move back and forth between both of these sides, that is how we cope and move on through our life, even with the grief. So I'm going to take us back to this image where we started as we're talking about dual process model and oscillation theory, and kind of spend a little bit more time with this image. So as we said, we have these two types of stressors that you see in these circles on either side. And our everyday life experience while grieving is this bouncing back and forth between the two, right? And you'll notice that this line between the two is jagged, right? It's not a clear and even process back and forth in the same cadence. And that's how grief works, right? In one breath, you may find yourself having an intrusion of grief or avoidance of any sort of change in life. And then in the next moment, you may need to be doing something that is around changing identities, that is part of denial or avoidance of the emotional piece of the grief, right? But to note that all of this is grief. I think sometimes when I hear people talking about this, they frame only the loss side as grief, but both of them are part of the grief. It's all grief. I love this image here too from an artist, bringing another image to what dual process model is like. So this has the similar kind of bouncing back and forth, the ping and pong in this machine of moving from the loss focus side to the restoration focus side, and what that experience is like. So just a couple of different images of how we can bring some of this to light. So what is distinct about dual process model? So I think a big one is that it accounts for that range of individual and subgroup experiences of grief and bereavement, that it doesn't have to follow a set path or stage process. Dual process model also has more space to account for cultural and social location differences that other grief theories may not give space for, right? If we lock people into a set path and process for grieving, it may not count for the diversity of cultural experiences and how different families and traditions and cultures express grief. Another big one is that this theory actually emphasizes and normalizes the need for time off or avoidance from grieving, right? Oftentimes we might think of, it's important to face the grief. I agree with that. And the ability to cope, that oscillation moving back and forth, that is what allows people to continue on in their life, even while being profoundly impacted by grief. So I think the other part of this is that dual process model is a framework both for describing what bereavement looks like, right? It's kind of like drawing an image of how are you experiencing this? And it's also a proposed method or model for how we can cope in the wake of loss. And as part of this research, I think it's helpful to think too about different people are going to oscillate in their grief in different ways. And so at its root, grief theory is very closely related to attachment theory, because when you think about a loss, that is sort of a shift and change in our attachment and connection to another human being. And so if you think about the different forms of attachment that somebody may have to a loved one, this is going back to early attachment theory, Bowlby's theory around and trials where you have a mother and a child in their experiment, and when you have a secure attachment, the child is in a room with the mother, the mother steps out, a stranger walks in, and the child is able to assess the situation and then securely move back to the mother when the mother comes back in the room. Similarly, in grief theory, you may assume that if somebody has a secure attachment style or attachment to this person that they've lost, that they may be able to oscillate more easily between those loss-oriented and restoration-oriented stressors. Somebody with an anxious ambivalent attachment may have a harder time moving back and forth and may stay more exclusively in the loss-oriented side. In that initial experiment around attachment theory, when the child is in the room and the mother steps out, they have a really hard time, have a more escalated reaction, and then are clinging to the mother when the mother returns to the child. An avoidant attachment style, you may predict that these folks may have a more restoration-oriented focus in their grieving, and they may delay or avoid some of the loss-oriented aspects and stressors. And then disorganized, you may see this in the context of trauma, where there's a less coherent or predictable manner of oscillating between loss and restoration. And so these categories here, it's not prescriptive, but I think it can be predictive. And that's helpful to us when we're thinking about what do we know about this person who's experienced a loss, and how might we be able to predict some of the ways that they will be grieving and surround them with support. So I think when we think about the evolution from the 1990s when this was first proposed to today, how has dual process model changed and continue to be applied today? Originally, when it was proposed, the conversation was around coping with the loss of a partner, but the research has since been more expanded to be applied more broadly for bereavement. One critique and ongoing conversation around dual process model is that maybe it doesn't account for overload or a bereaved person's perception of having more than they feel they can handle, too many stimuli, too many activities or events that makes it hard to even process this bouncing back and forth and oscillation. And then thirdly, that oscillation can be less accessible for coping in the settings of traumatic loss, where your body is in a state of trauma in the wake of loss as well. So that is a lot. We're going to pause here to have some poll everywhere.
Great. So the next question, which of the following may impact someone's ability to oscillate between loss and restoration-oriented stressors? And the first one, A, is attachment style, B is nature of the loss, C is access to resources, and D is all of the above. We'll give our audience several seconds to think about that. While they're doing that, I want to let you know, because we have a timer running, that I forgot to start that right on time, so we can add about 7 minutes to that. So
Great.
we are right about 42 minutes in.
That's great.
All right. So which answer are you hoping for here?
We are looking for answer D, all of the above, right? When we're thinking about somebody's experience of grief, there are a lot of different factors that may impact somebody's ability and how they're going to oscillate and cope with their loss.
All right. Thank you.
And then we have one more question
All right.
here.
Taking breaks from loss-oriented stressors to attend to affairs or logistics can be an adaptive form of coping after the death of a loved one. And this is true, false, so true or false. And again, we'll give you a few seconds to think about that and respond to that question. All right, and Reverend Brislin, which answer are you hoping for here?
We're looking for true here.
Great.
Right? We're thinking of grief as being able to take breaks. That is an adaptive way to cope. That actually, when we think about it, oscillation can be thought of as a form of emotional regulation, that you're able to sort of ebb and flow from these different emotional states.
Great, thank you.
So I think the big question for us is, how do we use dual process model in bereavement care? I think the biggest one we can think about is, how do we normalize the fluctuation or oscillation in people's experience of grief? and then supporting people to be able to move back and forth between addressing the impact of their loss and then focusing on some of those more practical restoration-oriented matters in their lives. That can be a helpful framework to think about coming alongside and companioning with people who are grieving. So in oncology specifically, what types of loss and grief may we be encountering? I think a big one here is secondary losses, which those are the things that, all of the things that change or that we experience loss around as a result of a first loss. So this may be that the diagnosis of cancer is the initial loss, and the secondary losses around role loss. We have a lot of folks who can no longer work their full-time job, right? And that is a loss and a grief that they're experiencing. When you think about, I mentioned this one earlier, the death of a loved one who someone was a full-time caregiver for. They're grieving the loss of their loved one, and there's also this secondary loss of their identity and experience as a caregiver. Another big loss to think about is the loss of connection with the care team, especially when we think about oncology care, where people may be spending a significant amount of time in healthcare settings, meeting with providers in different appointments, in many different healthcare settings too. Over time, these people can form deep connections and sense of trust around their care team. And so when someone dies, their family and care partners may also be experiencing a sense of grief around the people who surrounded them and walked with them and their loved one through treatment, diagnosis, and end of life. And then as well, when we think about this, is can be grief around the feelings surrounding how did the course of treatment go. We know that no two experiences are the same for patients, and that how somebody experiences care will impact the experience of loss later on. And so if somebody had a very supportive, well-adjusted experience while seeking care, that may impact their loved one's ability to cope with the loss. However, if somebody had a very quick progression through their disease, that may impact the kind of shock and grief that they're feeling as well at the end. I think sometimes it's helpful too to hear, if you have cared for folks and supported people who are grieving professionally or personally, I imagine that you have quotes or images or memories that feel visceral for you, where when you remember them or see them written down or maybe see a photograph, it can almost bring you right back to the emotions and experience of the loss. I'm going to share a couple of quotes here. These are things that I've heard in my work as bereavement counselor here and working with folks who are grieving, or as a chaplain supporting folks around end of life. This first one, I haven't heard anyone say her name in months. This was a husband 6 months after the loss of his best friend and his wife of 36 years. I don't know who I am now. A daughter grieving the loss of her father after being his primary caregiver through 4 years of cancer treatment. I knew she was sick, but I still never thought this day would come. A mother grieving the loss of her adult child to a relapsed cancer. What if I chose to remove the life support too soon? What if she could have gotten better? This is a son reflecting on the end of his mother's life on the first anniversary of her death. Even as I read these aloud to you today, I can feel myself becoming emotional as I remember each of these people and their stories that I've heard. And I think that each of these quotes represents some of the aspects of grief that we may encounter, especially for oncology patients, their families, and caregivers. I think this big one around, I don't know who I am now, these questions around identity. That first one about how important it is to hear the name of your loved one after their death. to know that other people are remembering them. This one at the bottom about knowing someone is sick and still not feeling ready or prepared, right? There's often nothing that can prepare us to lose the people we love most in this world. And then these kind of big questions that can be related to feelings of guilt or rumination, these what if questions. We hear these so often from folks, especially when they were alongside someone who was receiving care for a serious illness. So when we hear these different things, right, when we're in the presence of somebody who is grieving, what do we say? How do we respond? How do we support them? I think that Parker Palmer has some wise words that have been a guide for me and my care of people who are grieving. He says that the human soul doesn't want to be advised or fixed or saved. It simply wants to be witnessed, to be seen, heard, and companioned exactly as it is. When we make that kind of deep bow to the soul of a suffering person, our respect reinforces the soul's healing resources, the only resources that can help the sufferer make it through. There's so much in this quote, right, that relates to the essence of bereavement care. And I think that first place to begin in the first sentence is that providing grief care and bereavement care is not about fixing or saving people from the grief. We cannot take away the grief. And so sometimes the most helpful starting place is a reminder that our role and purpose will never be to take the grief away from people. Instead, it's to come alongside, to move toward the suffering, to be present with and companion alongside people as they are grieving, knowing that we cannot take that away. So what are some sort of helpful tips and framework when we think about supporting people who are grieving? I think the biggest one is leading with curiosity, to not assume that we know how they're experiencing grief or how things will go for them because of how things went for us when we have grieved in the past. A big one is listening actively. This includes things like eye contact, nodding, physical proximity to somebody. You know, if we're talking to somebody who's deeply emotional and we're backing away as they're becoming more emotional, that sends a message, right? Being present alongside. Emotional validation. Sometimes it's just normalizing for people that what you're experiencing makes sense. This is very sad. Allowing space for silence, right? Sometimes we can feel a pressure to kind of fill each space of silence in these really difficult and heavy emotional times with extra words or, feedback or information. And sometimes what people need is just to be with somebody. They don't need advice. Then another one is to allow people to express big emotions, right? Sometimes grief is not a very quiet experience, right? It may take on the form of weeping and wailing, and to allow people to naturally express the most authentic parts of their emotions and grief, that is a way to support them. So what are some sort of practical, helpful language pieces for grief? A big one, say the person's name aloud. When you are supporting somebody, whether that's at the time of death or reaching out after a loss, speak their name out loud. People routinely talk about the impact that it has when you hear your loved one's name said aloud. It's a reminder that everyone else hasn't moved on and forgotten them. Another thing is to reflect on the memories you have with somebody. I hear people sometimes ask, but will it hurt them or be upsetting to hear these memories or to be reminded of them? What I can say is more often than not, people are already reminded of the person that they love, that they've lost. They're thinking about them. And so again, hearing these memories, that's like extra tokens and pieces of their loved one to get to hold on to and add to their core memories of this person. Another thing that can be helpful is to express your own emotions, right? To acknowledge that as a human person who has known this person, that you too are feeling sad about what's happening. You might say something when you're standing with a family like, I'm sharing in your sadness, right? It is okay, and often makes people feel more connected to their healthcare team when people do express some emotion, right? We don't want people to be supporting us, and we don't want to take over in terms of emotion, but it is okay to express that we too are impacted by the loss of their loved one. And I think another one is reflecting gratitude, to express the honor, gratitude, humility we have in having known and walked alongside these people and their loved ones, letting them know that we too have been touched by the experience of knowing them. These are things that, any one of these bullet points here, when you say these things, that's going to stick with people, right? While we can't take people's grief away from them, when we do these things and offer these kind of supports that are about coming alongside, honoring the range of emotions they may be experiencing, that kind of support and care gets sort of attached to the memory of their grief. And so when they remember the worst moments of their life, when they've lost their loved one, they'll also remember the kind of support that came alongside them. On the flip side, it can be helpful sometimes to know what are the things to kind of not say. And what I'll say is that the list you're looking at here, this is all coming from people, who have experienced grief and heard things that either felt not so helpful or actually felt harmful or hard to hear. I think a big one is that to support somebody, we do not need to revisit the nature of, a traumatic incident, the tragedy of the loss, or discuss difficult details from their treatment process and reflect on those, right? We have other settings like debriefing and other spaces where we can talk about kind of the medical process and how things went or didn't go the way we'd hoped outside of the support for the family. Another one is to be sure that we're not offering or extending ourselves beyond what we can actually do or provide, right? We don't want to say, call me anytime, I'm here for you all the time, when maybe that's not realistic to what we can offer somebody. So we want to offer things only that we can do and provide. I think a big encouragement is that often you want to listen to people more than you're speaking. So you would want to avoid, if you're supporting somebody, you don't want to be speaking more than the person you're supporting is in that space. Some other ones that I think can be helpful is when we say something to somebody that's hurting, I know how you feel. While I think what the essence of that is trying to do is connect, right? We're trying to say, hey, I'm with you in this. I've been here before. What that can actually do is invalidate the rawness of what someone's going through, right? And on the flip side, when we say something like, I can't imagine what you're going through, again, I think what the essence of that statement is trying to do is saying, I honor that you are going through a heartbreaking time, but saying that you can't imagine, right? Often we can imagine, right, how hard this would be, the situation. That statement can put distance between us and the person we're supporting. And then, of course, we would want to avoid any kind of cliches or platitudes. There is a laundry list of these, right? This would be things like, there's a lot of religious or spiritual ones, like God needed another angel. There's, everything happens for a reason, right? I could probably list these on and on for you, but we won't do that. But what I'll say is that if you're trying to find something to say, like trying to find the right words, know that there's no right words to say, again, that are going to fix things, right? And so often when we try to use these cliches and platitudes, it's us trying to fill that space with something, okay? And so we want to avoid those as much as we can. Another one that's not up here explicitly, but any statement that begins with the words "at least," we would want to avoid that, right? That is a very minimizing thing, right? To try to compare their suffering to something else, at least they were older. I hear people say that, unfortunately, or have had other people say that to them. Well, that doesn't change that you've lost somebody in your life, right? And what I often say to people around this slide is people are going to hear difficult and hurtful things when they're grieving outside of, the healthcare setting. If we can try our best to avoid these things and prevent this from being another setting where they're hearing them, I think that's, worthwhile. So how do we actualize this? Our bereavement care, I believe, begins with the care at the time of death, immediately after and following a loss. How are we showing up and supporting people at the bedside, helping a family? Condolence cards, a written form of connection, phone calls. Another one would be attending a family organized event. So you would think of this as like a memorial service or a funeral. Maybe the family reaches out to you or you've learned about it. And then other ones might be creating your own ritual of remembrance. So at the end of life, how do we support people? A big one can be either leading up to or at the time of death, exploring people's traditions and customs and rituals around death and dying. That way that we can honor their experience, maybe try to make accommodations for those things if we know about things that they may need, whether that's specific rituals around care of the body after death or certain prayers that need to be said. Again, exploring with curiosity. I think a big one is remembering that, especially if you work in a hospital setting, that you likely are not facing this alone. And so how can you loop in the support of other folks on the team, like chaplains and social workers? Another one can be legacy support, right? Or can you help the patient as they are reaching the end of their life with writing letters to loved ones or recording voice memos or videos? Are there resources at your institution for doing physical legacy supplies, things like thumbprints, different things like that? Exploring what resources exist in your institution. Another big one is hospitality, especially when you think about people dying in the hospital. I so often meet families who've never experienced the end of a life in that specific hospital or in general at the hospital. So this might look like offering context for what's about to happen. What will this time look like? What are the resources here that they should know about? Not assuming that people will understand how to even walk around the hospital unit or find bathrooms. Very simple hospitality things are a form of care. Another big one at the end of life is helping people know how to interact with their loved one who's dying or has just died, whether that's inviting them to help be part of cleaning up or caring for the body if that's appropriate and indicated, knowing how to maybe put a cool rag or a warm rag on their forehead. We can often help people know how to move the bed rails at the bedside so that they can sit closer to and hold hands with their loved ones. Just thinking about how can we help this family navigate this space and this devastating moment so that they can have the most meaningful time possible right now. Next one we think about is writing condolence cards. Here are some tips to walk through. I think a big one is that these don't have to be long letters and vignettes, and you don't have to do it for every family. I think when you're able to, handwriting the card can show a lot in terms of you sitting down and taking the time to write a personalized note to a family. And what I'd say is that you want to be talking about things specific to this individual, right? That's propelling you to want to reach out. And be authentic to your voice, right? Especially if these people have spent time with you and know you, right? They want to hear from you. And things that I think can be helpful to include are some generic, I'm thinking of you. Again, expressing gratitude. It was an honor to care for your loved one. A general template that I often offer for folks to use is to start with the salutation. If you're writing to a group of people, you might say to, Tom's beloved family. Then we want to share condolences and care with the family. I am so sorry for your loss. And then you want to say something specific in the note. It can be just one sentence, that a memory you have of them, something you know about this person, and then offer in closing your thoughts. If it's authentic to you and this would be meaningful to the family, you might indicate that you're praying for them, and then offer, sign who is sending the note. I have this one here that, this is an example of something you might send here. This example letter talks about kind of these details of somebody who was a proud uncle, and, or this one here talks about his garden, being a grandfather, specific details that you would have gained from getting to know them. And of course, as we've mentioned multiple times, is in the letter, it's important to write out the person's name when you can. Another big thing is, again, remembering that grief and bereavement, as we've talked about, are ongoing, right? And so it's helpful to know, here are the things that I can do, right? Maybe you can be there at the time of death. You can reach out and send a letter, but can we be referralists and connecting people with other sources of support? Things that are helpful to look for are knowing about the resources at your local hospice organizations. Most hospices will provide grief and bereavement support for folks, even if their loved one was never served there and never received care from the hospice organization. So reaching out and knowing which groups do that. Can also be helpful to know which ones have pediatric grief support for young children who may have lost an adult caregiver or loved one. Knowing, if you work in a hospital setting, what bereavement programs and resources exist here in this place, and being familiar with those so that when the time arrives that it may be helpful, you already know what exists. Another big one is community support groups. Many local communities have these, and there's also online support groups that may be specific to a type of loss, maybe a specific type of cancer, for example. And so researching what's available in your area. And then there are other organizations such as Compassionate Friends, which is a grief support organization that supports parents and grandparents and caregivers after the loss of a child. And then again, encouraging or knowing how to connect people with a therapist or mental health professional. As we talk about all of this, I think it's helpful too to acknowledge that there can be barriers to receiving formalized bereavement care, right? While it's good to know what the resources out there are, what makes somebody more able or not to access them? Things like financial stressors, right? Sometimes people struggle to find a supportive community that gets it or knows about the experience that they're going through related to having somebody who was receiving cancer treatment for a long time, right? Different types of loss feel different. Their location, in some places there may not be as much access to certain grief support resources. And then a huge one is that often there's just not a huge awareness of what's out there. And so I think a big encouragement is when you are moving or in a new setting to just make yourself aware of what grief resources are there so that you can help bring awareness to folks, for folks, what is there.
All right, and as we start to wrap up, we've got one more poll everywhere question.
Yeah.
There's an answer there. Ignore that.
Yes.
That may or may not be the right one. Hearing from members of a loved one's care team after their death often intensifies feelings of distress. So that's a true or false, and we'll give everyone a few seconds to think about that and respond to that. Not going along with the answer that happens to be pre-filled there. All right. Dr. Brislin, or Reverend Brislin, which one are we looking for there?
Here we are looking for the answer false.
Mm-hmm.
Hearing from members of a loved one's care team actually offers a sense of comfort and connection and care. People often are missing the connection with the care team and feel supported by hearing from them.
All right. Thank you.
So as we conclude today, I think it's important anytime we talk about supporting other people who are grieving is to remember that we also, as clinicians and healthcare workers, are impacted by the grief and loss of patients. And so it's important to think about that how are we going to care for our own cumulative grief in this work? Knowing that there is a connection between experiencing loss and things like compassion fatigue and burnout. Some of the things that we can do to care for our own grief alongside supporting others is engaging rituals of remembrance. Does your organization have an annual remembrance time where you may read aloud the names of patients who are cared for? Maybe this would be debriefing with colleagues in an informal or formal way after a succession of losses or a particularly difficult loss for you. You can implement a pause. Maybe this happens after the time of death, where you pause in silence to honor both the patient, but also to honor the care that you've provided this person. And then engaging things like mindfulness, knowing what resources are available to you as well in terms of wellness and care. And I think it's always helpful to be proactive in thinking about what is your personal grief self-care plan, knowing that you will face loss and death in the workplace. What can you proactively be aware of that will help you to feel sustained and supported? These are a couple of different mindfulness techniques that you might use and engage with. These are about being able to recognize and acknowledge the experiences and emotions that come up for you, connecting with the common humanity that grief and bereavement are, that this is a part of the human experience. And then for all of these is being able to emotionally ground yourself, knowing that, if you work in a hospital setting, you may be caring for a dying patient and then, in the next moment need to go and be with another patient and their family. How are you going to ground yourself through a work day and the experience of loss, right? And then a big one too is knowing how can you be providing yourself the same kind of care and nurture that you want to provide to patients and their families. And the next few slides, which will be available for your review, I won't read these to you, of course, but it's just some resources for continued learning and supporting. And these are TED Talks and podcasts and books. I think just having places you can return to for continued support. These here, if you want to return back to this slide at another time, this would be things that you might offer to people who are grieving as resources that would be supportive to them. And that is the end of our conversation today.
All right. Reverend Brislin, thank you so much for the work that you do. This is amazing. What you've shared today is going to be a really important resource for years to come. And so we're very, very thankful to you on your final day at UNC for sharing this wealth of information. Yeah. I've got just a few things to share here. So, of course, thank you, and your contact information at your new workplace.
That's right.
All right. And then we want to say thank you to the state of North Carolina for the funding through the University Cancer Research Fund, to the UNC Lineberger Comprehensive Cancer Center, to our team, Venny Obore, John Powell, Oliver Marth, Andrew Dodgson, Patrick Muscarella, and Barbara Walsh for all that they do for each and every one of these talks.